Thank you. So some of my slides have already been touched on really beautifully by the other three speakers. So I will kind of perhaps zip through some of those and then talk about the self-care part. But, you know, obviously what we've been thinking about is the psychological impact of caring for others, which is what we do day in, day out as healthcare professionals. But clearly the last 18 months that we've lived through has really added to the burden of that. And, you know, you talked beautifully about compassion fatigue and burnout, and there are lots of different ways that we can feel harm at work psychologically. And it might be one event, or it might be lots and lots of little tiny events that sort of build up over time. And we can, you know, that might be trauma, vicarious trauma, post-traumatic stress. And I think moral injury particularly is one at the moment that's really important, because we are working in different ways and being asked to make decisions and choices at work that we have perhaps never been asked to before. And it can feel like something that we would never normally choose to do. So there's a lot of different ways that we can be feeling harm. And so that's why it's so important that we're looking after ourselves and protecting ourselves as well. Let's see if it will let me. Okay. So we talked a little bit already about compassion fatigue, and that might show at work or at home. And that's the sort of not being able to pour from an empty cup, just feeling like you haven't got anything left to give, really, like you just can't have your normal level of compassion or kindness. And I think, you know, that's quite common for all of us at points. You know, I know sometimes that I can feel it, and I know that then I need to take a break, I need to take a pause, I need to take a week off, because we're all carrying things, you know, that are very emotionally heavy in the work that we do. And I think we all, by nature, are people pleasers. We always want to do more, we want to go the extra mile, but that mustn't come at the expense of ourselves, our own health as well. Burnout is another term which has already been discussed, and I think that's really common. And if you look at the literature, it is in slightly higher rates for healthcare professionals than many other occupations, and that's just sort of feeling physically, mentally exhausted, like you've lost your drive, your enthusiasm, your motivation. Moral suffering is about making moral choices that you wouldn't normally want to do, that you're being asked to make choices. I suppose the easiest way to understand it at the moment perhaps is where there aren't enough ITU beds and somebody is forced to choose between two people who goes to that bed. That is something as clinicians that we would never expect to have to choose, and it can feel really shameful and really difficult. And I think moral suffering is something that it's really important to be aware of at the moment, because a lot of us are feeling that at the moment. Vicarious trauma is, you know, something that existed pre-corona. There are high rates, unfortunately, in midwives and obstetricians. So essentially feeling that you're having some trauma symptoms yourself because of what you're witnessing or watching at work. And that might be witnessing a very difficult birth, but it might be also witnessing poor care, bullying, not feeling that you can report concerns to your managers. So it can be all kinds of different things that can lead us to feel that sense of trauma. And I think it's just really important for us all as practitioners to think about ourselves, because we bring our whole self to work. Very few of us are able to switch off and disconnect and come into work and just be at work and then just go home. We come with our histories, with our stories, with our narratives, with our family histories. And I think it's really good if you can just start to tap in about your own fears, your triggers, your emotional wounds, and how they might play out for you at work. Because the more you can understand those, the more you can think about, what do I need, what helps me, what do I need to protect myself and keep myself really emotionally resilient and robust at work. So I think it's really worth thinking about that, because often we haven't really particularly, and it's a good thing just to take a moment after tonight and have a think about, perhaps. So in terms of support for you, that's already been beautifully talked about, but these are just some more practical things about what you might do in the here and now, because sometimes it can feel like we do not have a second to take a pause on a busy shift. But actually, probably we can take 30 to 90 seconds, and there's a lot we can do in that time. So smile at yourself, smile at a colleague. That's a really quick, instant way to make yourself feel better. You can do a minute or two of breathing. Actually, if you breathe, let's say in for 4, out for 4. If you look at people's brains in scanners, you will see them start to change after 90 seconds of breathing. So you can reboot your emotional nervous system really quickly just with breathing. You might just feel yourself physically, push your feet into the floor, or push your bum if you're sitting down in clinic all day like me, or just hum, sing to yourself. All those kind of things you can do very, very quickly as an immediate thing just to feel a little bit better. If you've got longer, if you've got 5 minutes, you might call someone, you might make a cup of tea, sit and drink it with a colleague, open the window, get some fresh air, you know, have a drink, have something to eat. I would say also for me, go and have a wee, because I think we're really good at never doing that in the middle of shifts. And actually things like that where we're not looking after our bodies, you know, we really need to, I think, sometimes get a lot better about remembering to do those basic things for ourselves. If you've got a lot longer, you might have a mini sleep, watch something funny that makes you laugh. There are all kinds of things you can do. And I think longer term, you might also think about what more might I need than these kind of micro moments. And it might be that if you've recognized, you know, you're on that curve of stress and burnout, that you actually need something more, that you might need some therapy, some support. And, you know, knowing what's available to you is really important, and feeling that you're able to talk about it with your managers and get that support if you feel it's needed, whether you need to take a bit of time off work. There are all kinds of different things that, you know, can be put in place to support you. So I don't know why these are so small. I'm so sorry. I'll have to even take my glasses off to read them myself. But just in terms of what other things for self-care, I think, you know, self-care can sometimes feel a bit tokenistic for people, but actually to me it's sort of self-worth, self-love, self-value. So it is really, really important. And like it's been said, it's not optional. It's not some kind of extra. It's something that we really need to prioritize. And, you know, I can give you a list of things, but it will be different for us all, what we enjoy, what gives us joy, what makes us feel that we're caring for ourselves. There's no one size fits all. So it might be, you know, being on your own, or it might be being in a group, it might be your faith, it might be being outside in nature, it might be the food you eat or cook to nourish yourself. And it's really about thinking about those things that really spark that sense of joy and peace and content for yourself. And everybody's list here will be different, but you know, all of those are really, really great options. I think, you know, rest is revolutionary to me. I think we live in a culture where doing is equated as being good, and we somehow now see rest as being non-essential, but actually rest is totally healing, feeds our soul, and we all need to prioritize rest. And I think we often feel guilty about resting, whereas actually I think we should all be resting as much as possible, wherever possible, because it is the single best thing that, you know, you can do just to slow down. So I think I would prescribe rest if I could, because I think it is absolutely essential for people, and there is nothing to be guilty about. I love resting as much as possible. I think just in terms of quickly support for teams, you know, I think obviously we take some of the responsibility ourselves for managing our own health, but I also passionately believe that the system we work in, wherever that might be, also needs to take responsibility for our health. So it needs to be both, not either or. So if we think about teams being psychologically healthy and safe, you know, that might be team debriefing, team reflective practice, some of it, you know, the evidence for some of those different things is mixed, but I think that certainly reflective practice for teams can be really, really powerful. And it has to be reflective practice where people feel safe to talk about anything without fear of judgment or criticism. But when we have a psychologically safe team, then we tend to thrive and feel psychologically well ourselves. So for me, I really believe it has to be both. We need to work within safe teams and also look after ourselves. And the way we do that has to be through authentic modelling. So if we want the system, if we're asking people to behave in a certain way, we need to model that consistently to them. And that needs to come from the very top down at every level within a system. And these are just different ways that, you know, I think that teams need to model how much they care for and want to protect and nourish the people that are working within those teams. So, you know, everything from making sure that people take breaks, regular reflective practice. You know, some teams have amazing program of yoga classes, some teams have an amazing garden, you know, all those little things that actually when they add up can make a huge difference to how we feel at work. And just to finish, I've put on, we can share the slides, I'm very happy to do that. Lots of different ways that you can seek support. So there are a huge amount of supports, particularly now there's additional support in for accessing through free therapy for anybody working within the NHS. The Samaritans have their own special line for NHS professionals that's 24 hours a day. So there's lots and lots of different sources of support out there. And likewise, if you look at the Make Birth Better page, we have a couple of specific pages around support for teams and professionals. And then there are also some books and workbooks there as well, which you might want to dip into. And that's me.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.